crow's feet or canthal lines, smile lines. So when you smile, there's lines around the eyes. Now here's a quick test for you. You're going to take the skin of your eye, take your index finger, go into the mirror, and you're going to pull down and you're going to let go. I want to share with you that many patients come into my clinic and complain about them, and I say, you know what, just leave them. They're not really an aging feature. After the age of 25, many of us have them. However, people want to address them. They do bother people, and in fact, more men come in for these than women. It's the first thing that men notice, and it's an aging feature that they particularly don't like. First thing I want to tell you about is prevention, and then we're going to go in things you can do at home, things you already have in your kitchen, inexpensive ways to remove them. I'll step it up in skincare, and I'll tell you about a few procedures you can do, and also 2 or 3 things to never put around the eyes. Why am I seeing fat pad loss, aging of the eye from, yes, skin products at home, but also some of the home devices people are using are aging the eye, especially laterally. If you're seeing that divot laterally at the edge of the bone, that's a sign. Now here's a quick test for you. You're going to take the skin of your eye, take your index finger, go into the mirror, and you're going to pull down and you're going to let go. You pull down the lower lid and you let go. See how quick the skin pops back up. That's going to give you an immediate indication of your collagen for the skin around your eye. You see the skin around the eyes 3 to 5 times thinner than that on the rest of the face. And that's why it's one of the first signs of aging, and it's telling you about collagen loss. So number 1, let's go through a couple things of prevention. The first thing is don't get them in the first place. The less you have to do, the better. And the top 2 tips I have, number 1, of course, is sunscreen. A lot of people don't want to put it directly under the eye because it irritates the eye. Find one that works for you and that you can use there. Maybe it's in your makeup. That's okay. Number 2, sunglasses. Wrap around sunglasses that, yes, protect the temple, because temple volume loss, loss of the precious little fat you have in the temple, leads to a sagging of the eye. That's why half of my day is spent filling temples. Now, what do you have in your kitchen that might work? Think egg whites. Many people, of course, have eggs in their kitchen, but for centuries, people have used the whites of the eggs around the eye. Now, how do you do it? You take the egg white, separate it from the yolk, and you put it around the eye. You leave it there for about 10 minutes, then you can wash it off. What are you going to put on now? Let's go through 3 appropriate things in terms of very inexpensive cold pressed seed oils. Number 1, this is a good application for coconut oil because coconut oil has linoleic acid. It's a great emollient, 2 great properties. Now you put it around the eye, and maybe not on the rest of the face, because about 30% of you will get acne about 4 days after applying coconut oil to the face. But for the crow's feet, it's worth having. Even if you're acne prone, you won't get acne here. You don't have the amount of sebaceous glands you do elsewhere. And you want to take this to the next level, you get your grapeseed oil. Put that in the tear trough area underneath the eye where the dark circles are. It's packed with antioxidants, anti-inflammatories. This is the area of the eye that gets inflamed, the under eye, and polyphenols, and it even has an antibacterial effect. Many of you have blepharitis around the eye or infection along your lashes. So coconut oil around the edge, and then take it to the next level with your grapeseed oil. A third, because I told you I'd give you a third, another good one around the eye, some of you might like, a high anti-inflammatory oil, which would be almond oil. Okay, so now you want to take it to the next level with skincare, but you don't want injections, you don't want procedures. What should you do? You want to think peptides. Peptides do not cause inflammation, they do not cause irritation, and that's what irritates the fat pads around the eye. Think about, number 1 is argireline. I combine it with a hyaluronic acid. Some of you are using it on its own. That's okay. The second one is a group of peptides in Revision's Line Relaxer. And I use this with when I do Botox injections in my clinic. And I use it as a standalone for those that don't want to treat anything around their eyes, but they want to use it topical. And this has a group of peptides that act like Botox, and that slows down the muscle movement. The muscle around the eye, orbicularis, oculi, it's paper thin. So when we're dissecting faces, sometimes you can't even see the muscle, but it's a strong bugger. It, as you know, for many people, especially men, when they smile, they get a lot of lines around the eyes. And by slowing down the muscle movement with peptides, that slows down the formation of lines and wrinkles, folds around the eye. For full disclosure, what do? I do everything I mentioned, and I do Dysport or Xeomin once or twice a year, more commonly once a year. I'll share the next step I do with you in a moment, but first, let's go to an injectable. So many of you know the word Botox. Dysport and Xeomin are the top two that I use in my clinic that patients love. And you want to think about 20 units around the eyes. It's very easy to do. Won't make you look unnatural. It will not droop the eye in the pattern that 99.999% of injectors use. I can't guarantee it for everyone, but it's a very low risk of drooping the eye, which is what you're all afraid of. And that unusual look, think 20 units. 26 if you want a brow lift with it, and that's about $300. Now let's say you're willing to do injectable, but you want all natural. Think platelet-rich fibrin. That's where you draw your blood, you spin it down, you get your growth factors. You know growth factors from skincare, they come exogenously from other people, cultured in a lab. This is all yours, but of course you need a blood draw to get them. And exosomes. Think about all your own from your own blood draw. That's what PRF is, and we inject it back. I do a lot of this in clinic. We do at least 120 a month under eyes, and we inject it back underneath the eye area, underneath the fat pads to help the fat pads look better, but also to help tighten the skin. The beauty of this, it's not a filler. We can even treat the lid of the eye. So if you're getting lines in your lid, you want to be very careful, but this can treat there. This is a good area also to think of polynucleotides. These are fragments of salmon DNA that mimic human DNA that upregulate the fibroblasts and are considered biostimulators. You'll hear more about these. I'll do a video in the future, but I use these quite a bit in Europe. What are the things you should never do around the eye? Number one, overuse a pure retinoic acid. You want to think retinaldehyde, and you want to temper it with anti-inflammatory products like avocado oil, and that's what I use in my retinaldehyde. And you can use, if you have your own retinol that you like that you're using, temper it with a good anti-inflammatory oil like we talked about at the beginning of the video. But don't overdo retinols around the eyes. It will kill your fat pads and can give you dry eye. Number two that I see, this one kills me because it's very hard for me to fix. People put PDO threads around the under eye, particularly the crow's feet you can often get away with, but remember I said the skin is so thin here? You can often see the threads. Threads are typically blue. They're made from PCL, PLLA sometimes, or PDO is most commonly used in this country. In Asia, we're using PCL threads way more, but in America, PDO, but they're all blue, except for PLLA threads. They're often clear. And then you can see blue underneath the skin, but if they create inflammation, which they often do, it's part of how they work, the under eye gets inflamed, and it's very hard to remove threads. I do not recommend even smooth threads directly underneath the eye. The third thing, at-home devices. This is a hard area to treat, and many of you get a device, your galvanic or your radio frequency device that you buy online, $300 to $500. You're very excited, and you think it's going to get rid of your crow's feet in a week, 2 weeks? No, think months, but here's the problem. A lot of them produce heat, and then you're going to lose the fat around your eye, because if you get the right temperature for the right duration at the right depth around the eye and you overuse those, it will kill your fat pads. I use devices to kill the fat in the lower face because we don't want heaviness and fat in the lower face, and we get it there as we age. So those same devices that you are using at home, if used improperly, if you're using the wrong ones, if they're cheap, the temperature levels fluctuate from every time you turn that thing on, and I see it in my clinic. I want to share that with you because why I'm doing so much PRF under the eye is people are damaging their own eyes trying to do everything at home. I want you to do things at home. I want you to be safe at home. And this is all going to make sense when you watch this video about how to maintain and restore your fat pads at home, and one down here on an under eye cream you can make for under $15 to keep your skin and body beautiful, healthy, and vibrant.